Hey, hi, good afternoon, everyone. Thank you for joining us and being so on time. I think we're ready to just start the talk for today. So hope everyone has had your lunch already and are ready to learn something new. So today we have Qiaoyan, who will be talking to us a little bit more about the topic of depression in the elderly. Let me just go through some house rules first before she starts the session with you. So if you have any questions along the way, please feel free to use the Q&A function. So it's actually at the bottom of either your laptop or your mobile phone. You can click onto it and you are able to enter your questions. So our speaker will have a little Q&A section after the end of her slides. And then that's where you can take the time to ask some questions and she'll answer them. If you have any questions along the way, also feel free to type it in. It'll be consolidated at the end. Lastly is also that after today's session, there will be a short survey form. So really appreciate it if you could help us fill it in as well. So without further ado, we're going to pass the time on to our speaker today, Qiaoyan, to tell us about the topic. Qiaoyan, please.
Hello, good day to everyone. Thank you for coming over to attend this talk. I'm Qiaoyan from Pakku. Today I will be talking about depression in elderly. My presentation will take about 20 to 30 minutes and is divided into 4 sections. Section 1 is to share some knowledge of depression in elderly. Then I will continue to explore clinic features of elderly depression, followed by management and preventions. Finally, I will show you some resource and support of elderly depression. Please don't hesitate to interrupt me if you have any questions. Towards the end, if there will be time for questions. Let's start today's talk. So depression is a common mental disorder. It involves a depressed mood or loss of pleasure and interest for a long period of time, impairing people's ability to function or cope daily life. So how does depression affect us? Depression affects the body, mood, and mind to the extent that it disrupts normal social relationships. It affects the way we eat and sleep, how we feel about ourselves. People with depression may have difficulty in interpersonal relationships and daily works, and may not be able to work towards their life goals. So this one, as mentioned by World Health Organization in 2023, approximately 280 million people in the world have depression. 5.7% of adults whose age more than 60 years old. So prevalence rate of depression in Singapore is 6.3%. Prevalence rate of depression of elderly in Singapore is 5.5%. We can see from above corner diagram. So from this corner diagram, we can see in 2011, about 10.4% of Singaporeans were age 65 and above. A decade later, in 2021, it has risen to 17.6%. Now it's 2023. By 2030, another 7 years later, it will be 23.8% of Singaporeans who were age 65 and above. Singapore's population is aging rapidly. We'll have more elderly people will develop depression. So we need to pay attention to this problem. But we have some challenge in identifying depression in elderly. Identifying depression in older adults can be challenging because this may show symptoms in different ways compared to younger individuals. This is because cause of depression in elderly and in adults is different. So show the symptoms also different. Furthermore, depression in elderly is often mistaken for symptoms of other illness and the side effect of medications intake. So now we can watch this video together about Linda's mother who had depression. So from the video, we can see the causes and the symptoms of the depression, but in the end, Linda's mother become treated and become stable, right? Yeah. So now we continue, we move on. So the next slide, we are talking about common cause of depression in elderly. There are several causes of elderly depression. Depression in elderly is brought on by poor physical health, being single, window, or divorce, or social isolation, or poor social support. The last one is the empty nest syndrome. So for the poor physical condition, depression can be brought on by medical condition that alter how the body functions, such as thyroid disease, stroke, and cancer. Yeah, reduced mobility and arthritis are two additional medical issues that make it more difficult for individuals to handle alone. Since they require greater assistance from others, it could result in depression due to loss of autonomy and dignity. So for being single and widow or divorced, older adults often go through very difficult time of loss as being age. This might include lost loved ones or friends and their health, pets, or homes. While some people manage those challenge circumstances well, the recurrent loss experience can occasionally result in depression. So for the social isolation, people can grow less connected to their friends, family, and the community as they age. It's very difficult for them to go out to meet their friends and family. This can be because friends and the classmates have passed away or because they have trouble getting around to visit others. Okay, so for the empty nest syndrome, this one is happens when their children moving out family home, the elderly will feel lonely. Yeah. Okay, this slide we will talk about symptoms of depression in elderly. So first one is feeling sad or empty. Then loss of interest in previous hobbies. They don't care anymore about previous hobbies, social activities. Then lapses in personal care. Then the elderly skip meals, forgot to eat medication, neglect personal hygiene. Then they also can experience like trouble in sleeping, either insomnia or oversleeping. Then change in appetite and weight. Either overeating or low appetite to eat, then cause weight gain or weight loss. Then also have the poor concentration or poor memory. They have trouble in focusing, make decision or remember things, feeling hopeless, worthless, or guilty. So this one can lead to the elderly have the suicidal thoughts or attempts. So this one, now I will share about the management of depression in elderly. Yeah, I have three parts. First one is psychotherapy, then followed by pharmacotherapy. The last one is the ECT, is the electroconvulsive convulsive therapy. So for the psychotherapy, also called talk therapy, is a treatment designed to help you identify and change unhealthy emotions, thoughts, and behavior by talking to mental health professionals. So for cognitive behavior therapy, this one is to teach patients to think logically and avoid negative self-talk. Interpersonal therapy aim to equip people with social skills. According to data suggests that in elderly patients with depression, psychotherapy is same effective as antidepressants. Also have some studies shows that the elderly have more positive response to psychotherapy than the younger adults. Cognitive therapy and the interpersonal therapy has been found to have sufficient evidence for management of depression in the elderly. So in our Thompson Hospital, we also have cognitive behavior therapy and the support therapy for patients, unless the patient has some degree of cognitive impairment. Patient need a referral or memo from doctor indicate patient need psychotherapy, email to the contact center, then we'll send it to clinic 4A, which is the psychological clinic. Their staff will arrange appointment. Psychotherapy, how many sessions? How many sessions needs will depend by doctor. If severe, may need longer. If more severe, doctor will refer them to IMH. So second, we will talk the pharmacotherapy. So this one mainly used is antidepressant. So antidepressant, usually the medication must be started in the lower dose, and the dose will be titrated upwards depending on the response and the side effect of the experience. So this is the one we call start no and go no. Antidepressant side effect may be delayed in older adults as compared to younger adults. Response may take 6 to 8 weeks, and treatment may need to last more than 6 months. So now I will share about the different type of antidepressants. So for the first one is the mainly used one is selective serotonin reuptake inhibitor. This one is have less side effect, more safer but expensive. The second one is the serotonin and the norepinephrine reuptake inhibitor. This one when people are successful with SSRIs, the patient will use this one. This one is a good choice for people with anxiety as well. So for these two groups are effective first-line therapy in managing major depressive disorder that less side effect than TCA and the mouse. So this one is the third one is tricyclic antidepressant. This one is for whose depression is resistant to other drugs, but this one is cheaper, also but have more side effect. Then the last one, this one is a very old class for the antidepressant. This one take time to work but helpful with other therapy. This one have more side effect. As we know, as a drug confirmed have some side effect. But for antidepressants, the common side effect of the depressant. So now I will share about the common side effect of antidepressant. So the first famous one is the GIT symptoms, which is the nausea, vomiting, diarrhea, constipation. The second one is the hypernatremia. Hypernatremia is the sodium level in the blood is below normal due to selective serotonin reuptake inhibitor can develop within few weeks or months after initiation of treatment. This because when the elderly take the class of medication may need to build up a fluid inside the body cells. That's why some patients need to do blood tests for checking electrolytes. Then it's a dry mouth, fatigue, and headache, insomnia, and weight gain. So what you can do for those side effects? So first of all, you need to talk to your doctor about the side effects. And for the important one is do not stop or cut down dosage by your own. Do not change antidepressant time unless consult your doctor. For example, sometimes you eat the antidepressant in the morning can cause you very drowsiness. Then you cannot focus on your work or something. Then you can ask your doctor, can check the medication at the bedtime or not, then you can sleep well. So then can eat smaller, more frequent meals if you experience GI side effect. Then stay hydrated. This one is for dry mouth one. So last one is eat healthy food and do regular exercise and consult dietitian. This one is for some patient may experience of constipation and weight gain. Yeah. So last one we talk about the electroconvulsive therapy. This one is called ECT. ECT is using electric current through the brain to induce a brief therapeutic seizure by application of electric current through the electrode over temples. So we can see from the picture here. So the electrode is here, held by doctors. Then we will on the electric, then the patient can cause seizures. So for this one, ECT is used for those not responding well to medication and the psychotherapy. And for those severe depression with suicidal thoughts, then the doctor maybe suggest them to do the ECT. However, we still got some challenge in treating depression in elderly. So the first one is to attribute depressive symptom to lateral part of agent. Then the second one is the stigma associated with the mental illness. Then the third one is poor mental health literacy, and also like the coexisting medication problems. Then because of got so many of the coexisting medical problems, the patient will take multiple medication daily. And this one also can like some patients will prefer to see doctor for medical problems, then overlook the psychological service one. So the last one is sometimes the patient will be misdiagnosis of depression and dementia because sometimes the signs and symptoms quite similar. Okay, now we move to prevention of elderly depression. So the first one, to stay social and stay connected with family and friends. Then to make time for leisure activity. For family to show them they are loved. Then to do a gentle physical activity, for example, like walking, yoga, tai chi, prevent isolation and also to prevent function decline. And also need to get some sunshine. Cannot always stay at home. Need to go out, meet friends, and make a new friends. And also need to have enough sleep. For elderly, sometimes it's very difficult to sleep lah. So make sure the room is very quiet and very dark. Then it's very easy for elderly to fall asleep. And also it's very important to have a well-balanced diet. And the last one is very important to watch for the early symptoms. If you have the early symptoms, you need to go hospital to consult with the doctors. Then they will give you the more treatment. So this one is the resource and support in Tan Tock Seng Hospital. So for psychosocial support for TT Tan Tock Seng Hospital patients, we got the care and counseling. So this one is in medical center at level B2 lah. Here is the contact is here. So for change in existing psychology appointments, this one you need to contact this number and at medical center clinic 4A at level 4. Yeah. So for more information, you guys can scan the QR code or visit this link. Besides seeking help from our hospitals, the hospital also help link those elderly to more suitable support service like AIA. Doctor can help provide a referral form to them to those service. If patient is like uncooperative or the patient is very restless, then maybe the doctor, then the AIC cannot receive this patient, then maybe we need to refer this patient to IMH for further treatment. So the center staff are unable to handle. So for some patient is a stable medical is stable and the light is very easy to handle patient. The staff can patient in the center will do some activities, and the staff will also help them to treat their condition. So for this conclusion, depression in elderly are common. It is treatable medical problem, and it is not a normal part of aging. It is important to detect early symptoms and seek help. Suicidal is a serious concern in depressed older patients when in severe condition. A combination of antidepressant medications and psychotherapy is effective in treating most elderly depression. So prevention is the king of depression in elderly.
Okay, so I think that's the end for our speaker section. So actually now we'll be going to a Q&A. Yeah, so basically if you have any questions, feel free to type them into the chat. I do see a few that have already come in, so maybe our speaker can just give her like a few minutes to look through them and then for her to answer you properly as well. But in the meantime, you can still think through about the topics that were shared with you today and then type it into the Q&A section. So at any time, we'll just let our speaker answer the questions. For those questions that maybe are a little bit more specific to what you have been asking, our speaker will be typing the answer to you. So just give them a moment.
So how often we have the ECTD? So in Tantosan Hospital, we do the ECT for patient. It's normally Monday, Wednesday, and Friday. Around morning, like 8:30 to 9:30. Yeah, we will do for patient at Paku, at my department. Yeah, the doctor and the anesthetist will do for the patient. So normally the patient will have the 12 session. After the 12 session, doctor will say first, then decide will continue do or no need. Okay, how to differentiate between depression and dementia? So for the dementia, we'll have cognition or memory loss for this patient. Yeah, cognitive impairment. For depression, meaning is depression symptoms. Yeah. How do we know or tell there is a misdiagnosis of depression and dementia? So usually it may not misdiagnosis. It could be overlap.
Hi everyone. So today actually we also have Sister Pirong, our advanced practice nurse with us to answer some of your questions in more detail. So maybe we can just give her the time today and she'll answer your questions in detail. Thank you.
Hi, good afternoon. You can all hear me? Okay, so I would like to take this question. I think this is a good question. Elderly patient has a short sleep hours. Then they will sleep on the night time and they sleep on the day and awake at 2-3 a.m. So for this group of patients, it's not easy, but usually we advocate, like just now my nurse was mentioned about psychotherapy. So we try to engage the patient during the day. So and sometimes we also doing some exercise and make them engage the physical exercise, even the simple one. Then when have an exercise, then they are more active. They use energy during the daytime. Then at nighttime they can sleep a bit better. So and it's more on the engagement lah. For it's a slow engagement and make them more awake on the day. Then they can sleep better on the night. And of course, we also avoid during towards the night some stimulants like tea or coffee, especially after 12 noon. Then also avoid some fluid intake, drinking water, like in the afternoon. So because their bladder capacity to hold the urine can be quite short, then they could wake up to pass urine at times. Okay. So I think that is the kind of like practical tips at home you can try. And if really you have a lot of difficulty, because sometimes they do have some patients have a dementia, some the insomnia, the poor sleep can be one of the symptoms of the dementia. So then you may need some medication help for sleeping. So usually like we start with something small, And by knowing your loved one, you know which work better for them. Yeah. Okay, so yeah, so for I will address this question. Do we need a referral on the or can directly go to the care and counseling? Usually, like you can get a memo from the polyclinic or GP. Then for with the memo, then you can get the appointment for care and counseling. So I guess I already addressed some of the question. So any more questions? Okay, so I would like to also address this question. Do we visit the GP first for the depression diagnosis? Okay, so it depends on the new diagnosis or, oh, okay. Can you hear me? Okay, it depends on whether it's a new diagnosis or it's a kind of like overlapping medical condition. So if you suspect some of depression symptoms, just now Nurse Wu was sharing, then you could go for the GP to consult first. So the GP main thing can help if you want to refer to specialized, then there are some discount cost saving per se. And usually if a new diagnosis, usually GP usually won't do the direct diagnosis for depression. Okay, so I think one question is asking what's the exact side effect for the amitriptyline, I think. So that is a common antidepressant we use to treat the depression. So the common side effect, like I mentioned, hyponatremia, it could be that the sodium level was low, it could be one of the common diagnoses. For the newly started drug, it could be a GI discomfort like nausea, vomiting, poor oral intake, or diarrhea. So that's a main common side effects. Yeah. So there is another question come in. For the care, what if the caregiver is depressed, trigger in the elderly? How could we report these issues? So I not really get these questions. So maybe you can type in this question. I don't really get the questions. Okay, so maybe I move on to next question first. So how can the home care service assist? So it also depends on the need for what kind of need for the home care service. Home care service, usually we have a home medical, means a medical doctor can go to your house, or home nursing means if you need some nursing care, then the nurses can go to the home, or home therapist. So we can have a physiotherapy or occupational therapist go to the home to provide service. So, and another home care service could be a transport service. So it depends on need. So if you can foresee your loved one need all these service, then you can refer accordingly. So the easy way to refer is mainly for the home nursing. So you can look for the Home Nursing Foundation. Or if you really need some other service, you can log into the AIC website. Then they can guide you what kind of service and how you get there and the cost per se. Okay, so I guess there's a lot of interesting questions interested on the ECT questions. So for the ECT therapy, there's a treatment for antidepressant. But to be honest, in the older population, the ECT section usually seldom advocate for elderly because there's a lot of complication also. But for elderly population, we are more looking for the psychosocial therapy and also medication. So the ECT section usually more advocate for slightly younger patients. I think another question is about the side effect of the ECT and how many rounds of the ECT. So the side effect of the ECT, it really depends on the patient and also the core mobility, and how many rounds is also really depends on what's the intention for treating and also the severity of depression. So I guess here we may not able to answer this question in detail. So if you are really you are consider this ECT treatment, then you can consult the medical team because it really based on the patient itself per se. Okay, I saw more question coming in. Okay, I try my best to answer. Okay, so okay, my mom, one question was raised. My mom sleep well at night and during the day. She still dozes off sitting in the chair or even take after naps. Is it normal or too much sleeping? So I guess like this is also, I would like to ask, like you may need to look at your mom, what's the usual sleeping pattern and also the sleeping hours. So if you, because like some, for sleeping hour, usually for us, each of us are quite different. And if really that's your mom's usual sleeping hour, then you can just like, if not a major concern, I think you don't want to change the routines, but it's really not her usual. So I think like just now we mentioned a bit engagement, also good to, sometimes we also advocate some daycare or even your downstairs a senior group at the activity center. So actually just send for 1-2 hours there, they have some engagement, social interaction. So sometimes it helps with the sleep also. Okay, so any more questions? Okay, 2 more questions. Okay. Yes. Do need a referral for what? What referral? For ECT or for the depression diagnosis? Home care. Like just now I mentioned, if your mom was in some of the follow-up, you can ask for raise the service through the AIC. So you yourself can even go to the website itself to submit some of the documents or some assessment. So AIC, the staff in charge, then they'll be going to reach out to you for to call you and to understand what kind of service and what's the cost per se. I think there is the question for, yes, that's the correct spelling, yes. Yes, that's a correct spelling. Any more?
I think we do have one more question. Yeah, in the Q&A. Maybe this will be our last question.
Okay. Okay, treatment mentioned during this talk, is it only applicable for elderly depression patient or for all depression patients? Okay, so the treatment, just now Nurse Miss Wu was mentioned 3. So actually, generally, they are applied for all the patients, but particularly psychotherapy is the first line treatment. But for older patients, usually be a bit mindful, especially for the medication wise. Just now Miss Wu was mentioned, start slow and go slow. Start slow means like the dosage, we are slightly lower dose than the younger population. Go slow, even need to titrate the medication, we also titrate slowly. So that is the majority is a bit more applicable for all the patients. Yeah.
Okay, thank you so much to both our speakers and nurses today for answering all your questions. And I think they really took their time and a lot of patience to answer each of one of your questions. So hopefully they have been helpful to you. So I think that's the end of our presentation. Before you go, I just have the next slide. Yeah, so I will just need you to help us fill in a feedback form, yeah, for the survey. So I'll just show the next slide first, yeah. Okay, thank you so much. Yes. So if you see on the slides now, we do have a 4SG link. So if you could just scan the QR code, or my colleague has also put in the link that you can just click easily from the chat box. Yeah, we really appreciate it if you could just fill in the feedback form so we know how to improve for our future sessions. And at the same time, just now it was shared that we do have a repository of like information. So that's on TTSH Health Library. So if you're interested to find out a bit more about all these kind of topics, and you can read it in your own time as well, go ahead and visit our site. Yeah, we have a lot, over 900 resources there. And lastly, just one more update is that we have our Singapore Patient Conference happening this year. So we do talk about a lot of topics regarding the health and social care of all the community and all our patients and residents. So if you're interested in topics like depression for elderly and wanting to find out if there are other kinds of support groups that are available, you can also come and join our Facebook or Instagram. It's also on the slide at the moment. Yeah, so you can scan or you can click to join us, and we hope to see you at our event this year. Yes. So I'm just going to leave the QR code on the screen so that you have enough time to scan it and fill in your feedback form. If not, we'll be ending the session here today. We'll close the Zoom room at 4 o'clock. Yeah, so then it gives you about 5 minutes to scan and feedback. Thank you so much to everyone who has joined us today. Thank you.